Are you looking for safe core exercises after hysterectomy? Hi, I'm Michelle and I'm a pelvic health physiotherapist. Many women say to me, Michelle, what can I do for my belly after a hysterectomy? I feel like I've got a swelly belly. I feel like I've got a bloated abdomen. Have I put on weight after my hysterectomy? And this is a really common problem. And unfortunately, women aren't routinely given safe core exercises to start during hysterectomy recovery. So more often than not, women spend the first 6 weeks waiting to see their surgeon at 6 weeks and not doing any core recovery, when we know that exercising the correct muscles, the deep abdominal muscles, can support your wound, help you move around with more comfort, and regain control over your lower belly muscles, which are the muscles that flatten the tummy. So today I'm guiding you through the safe core exercises that I give many patients both in hospital and during their hysterectomy recovery. Now, the first 2 exercises are exercises that most women can start in hospital. So that's good news, isn't it? You can actually start your exercises often when you're in hospital, but also when you go home during weeks 1 to 6. So you can do some really positive, proactive exercises for your deep abdominal muscles during this recovery time. These core exercises are appropriate for almost all women after abdominal, vaginal, or laparoscopic hysterectomy, but always be guided by your medical guidance and the medical advice that you've received. And if any of the exercises feel at all uncomfortable, stop them and start them when you feel better recovered. Let's start these exercises now. What I'd like you to do is to bring one hand over the lower belly. And we're going to be breathing into the lower hand. The way to do this is to start by slowly inhaling through the nose. And we're going to take that breath right down to the base of the lungs. And when you do that, you'll feel the belly rise underneath your hand. See if you can do that with me now. So slow, deep breath in through the nose. Fill up your lungs. Feel your belly rise up. And now let the air softly fall away through your nose and through your mouth and relax. Great. Let's do another one. Slow and deep in through the nose. Feel the belly expand and rise. And now let the air escape. And just with that passive movement of the abdominal wall, the pelvic floor moves down just gently and the abdominal muscles expand. And that's just a really gentle relaxation movement for these muscle areas. One last time. Here we go. Slow, deep breath in through the nose. Feel the belly. Feel it rise. And now let the air fall away and escape. And you can start doing those exercises, diaphragmatic breathing exercises, on an hourly basis. The next exercise we're going to be doing is our abdominal activation exercise. So this is key. Just make sure that you've had any abdominal drains removed before you start this exercise. And very important to note that all of these exercises should be comfortable. If you feel any discomfort, cease them straight away, and you might like to resume them at a later date. To activate these muscles, we're thinking about this area down here, and this is the area below your briefs. So if you find your navel with your thumb and place your fingers, hand down towards your pubic bone there. And it might be over an abdominal wound. That's okay. We're just putting the hand down very gently. The reason we're doing this is to feel the movement with our deep abdominal muscles as we switch them on. So we're going mind-muscle connection, because that can be disrupted after a hysterectomy. So we're actually trying to switch these muscles back on, cue them to switch back on and to activate. So this is a control exercise. We're not strengthening yet. We're not doing any of that. We're just getting these muscles switched on very gently. This is how you do this. Underneath your hand, imagine the area where your briefs are, so where your briefs run. That's where these deep abdominal transverse abdominis muscles run around through the front, and they actually run right around to the back like a corset, and they actually take the role of a belly band. So if you've been using a belly band, that actually doesn't help these muscles. It can support the wound, but what it can do is take the role of these muscles. So while supportive underwear and belly bands can be great when exercising, it's a really good idea not to wear them all the time, particularly during these exercises, because they can take over the role of the abdominal muscles and actually make them weaker. And we want to train these muscles to work when we're moving around to actually tone our belly,
get these muscles working to support our pelvic floor and to support our spine. So this area here, what we do is we very gently draw that area in just slightly. So imagine you're drawing your abdominal wall away from the front of your briefs, just in a tiny little bit. So we're talking about, less than 1/4 of an inch or 5 millimeters, drawing in just very gently, and then try to breathe, and then release and let go. That can be really difficult when you first start out, particularly if you've got an abdominal wound, and particularly if you've never done these exercises before. An easier way of doing this, what I find with most patients, is to start this exercise lying on your side. So if you're around 2 weeks, 3 weeks, if you feel comfortable lying on your side, this is a really good way to cue yourself into doing these exercises. And I'll also talk you through doing these exercises in standing as well, so that you know how to do them in that position too. So I'm going to come onto my side, and if you're not already on your side and you feel comfortable coming onto your side, try not to twist through your trunk. Try to roll like a log so the arm comes across at the same time as the knees roll onto one side. And in this position, what you can do is you can relax your belly right down. When you relax the belly right down, the beauty of this is you can look down. On your back, you can't look at your tummy, can you? Because we're not supposed to be lifting our head off the pillow and using these upper abdominal muscles. On your side, you can look down quite safely. If you bring one hand over this area here, what you can then see is that very subtle inward movement, and then the letting go of that lower abdominal wall. Now, some other cues to help you if you're not sure and you're still lying on your back, you can also try a very gentle pelvic floor exercise with this. And for some women, the pelvic floor muscles, activating those muscles, kicks on these deep abdominal muscles. They work together. So what you can then do is to try to squeeze around your pelvic openings, so around your anus, the vagina and the urethra, just gently, and lift inwards. So I'd be doing that action in this side lying position. And if you try that now very gently, you might feel a very gentle tension develop in that lower abdominal area. If you can do that, feel that area there. And now allow it to relax and rest. How did you go with that at home? This can take quite a bit of practice, particularly if you've had incisions in the abdomen and the muscles aren't working well, or if you're over-bracing and guarding, this can take some practice. So doing the diaphragmatic breathing exercise that I just showed you, and then doing these activation exercises on your side, in sitting and in standing, which I'll show you towards the end of the video, are really helpful for activating these muscles. Now, once you've got these muscles activated, you can progress to the following routine that we're going to go through now. Now, this routine of exercises is done lying on our back. So let's do that together now. Bringing your hands up over your lower belly, and this is to feel that gentle tensioning of that lower area during our exercises. Our first exercise is a butterfly exercise. We're going to start with a really gentle in-draw of the lower abdomen. So there's your in-draw. See if you can hold that for a couple of breaths. Hold, and see if you can keep holding and breathing. And now relax and let go. So holding that exercise with the breath is a challenge to those muscles in itself, because you remember when you're breathing deeply, your belly wants to expand, doesn't it? So we're trying to use those muscles to withstand that outward pressure of the breath. Let's do that again and add a little bit of challenge to it. So abdominal muscles on gently, keep that normal inward curve in your lower back. Now, as you do so, slowly lower both knees out, away from the midline. Keep the tummy muscles contracted if you can, activated gently. And now bring them slowly back up together. Can you keep that abdominal contraction? And release. Have a big breath in and let the air out. Let's repeat that one more time. Tummy muscles on gently. Here we go. Both knees out, opposite directions. You can see that I'm not taking them far. We don't need to take them far at this stage. It's just early days at the moment. And then let's bring the knees back together and let's relax. All right, next exercise, we're adding a bit more challenge to this exercise and a bit more challenge for the abdominal muscles to have to work harder. Now, I have a cup here to help me with these exercises, and I'll show you why. You don't need a cup, but it's just a bit of a demo, just to give you a bit of an idea. This exercise is called a bent knee fallout. The abdominal muscles are on, inward curve in the back. Now, what we do is we lower one knee down to the side and back up. These deep abdominals stop the rotation of the body. So what you can do is imagine, this is the reason for my cup. I know it's not the right way out, but I've got a bony knee. So what we're going to do is balance this cup full of your favourite drink. What is it? Champagne, coffee, whatever it is. Now, tummy muscles are on, inward curve in the back. Keep that back curve the same. And now lower the right knee down to one side. Don't let your drink spill. So you've got to keep that navel facing upwards. As soon as you feel your body start to roll or your cup tip, there we go. So see I rolled too far? That's when you need to stop. So you didn't use a cup, but you'll be able to feel when your trunk starts to roll, or use your hands here. So let's try again. So we're going to go right knee down to one side, keep the tummy activated. And that's my point there where I'm starting to roll. And bring the knee back up to centre and relax. Oh, it's raining outside. I don't know if you can hear it. It's really lovely sound. Very comforting to hear rain on the roof, isn't it? Now, the muscles that are stopping that rotational movement are your deep core muscles. So this is how we're providing those muscles with a challenge to work. All right, tummy muscles on again. Engage them. Now the left knee is going to do the same thing while we balance our drink or whatever it is we're balancing on our knee, our right knee. Take the left knee down to one side. Keep the right knee stable. Keep your navel facing towards the ceiling. Try not to roll through your trunk. So a lot of control. It takes a lot of concentration to do this exercise as well. Bring the knee back up and release. So I like to start with alternates, first of all. You might like to start with one knee on one side, doing a couple of repetitions on that side, and then the other side. We'll do that one more time. Let's go right side again. Take the knee down. Keep the belly braced. Try to breathe. Keep the movement smooth if you can. And slow. Slower the better. More control involved in a slower movement here than a fast movement. And release. One more to go. Let's go left side. Take the knee out and down, just slowly. Keep the tummy muscles activated. And come back up. And relax. Bring your arms down by your side and let's do a pelvic tilt. So what we're going to do is roll and flatten out through the lower back. So you're flattening out the arch. I'm lifting my bottom upwards just off the bed and rolling back through. This is a nice way of taking tension out of your lower back and your pelvis. It feels a bit stiff from resting in bed. And it's also a nice little release as we change exercises. So one more time, just a gentle tilt, not forceful, and roll back through. We have two more core exercises to do. The first one is called a heel slide. Now, with a heel slide, what you do is you keep your foot in contact with the bed and you're going to slide it along the bed and back up. But we're going to use it to challenge our deep abdominal muscles, our core muscles, to work a little bit harder because they have to work harder as our limb moves, as our leg moves, to control the arch in our back. So what you'll find is when you move your leg too far down, you lose control, your back starts to arch upwards, which is what you don't want. So hands on your tummy muscles, gently brace, a gentle indraw. Now, start to slide that right foot down along the bed. And with your right hand, you can feel your arch. And when you feel that arch start to lift and raise, stop at that point, keep your belly braced, and then slide the heel back up. And when I say belly braced, I mean very gentle abdominal activation. It's not that really firm brace that we hear in some instructions. This is a gentle brace. Let's do the other side. So tummy muscles are on. Slide slowly. Keep the control. Try not to let the back arch and tilt forward. And then slide back up and relax. Let's do one more each side. Tummy muscles on. Right leg sliding down and away from the body. If you're wearing TED stockings or socks, that can be really helpful to slide your feet along sheets of the bed and back And the other side one more time. Tummy muscles are on, remembering to breathe throughout the exercise if you can. So much to think about, isn't there? Sliding the heel away from your bottom. You'll know that point you'll feel when your back starts to want to arch. And then slide slowly back up and release. Here's our final exercise for the day, our final core exercise progression. I'm going to give you two choices here. If you're just starting out here with these exercises today, you can do the first one, that's a modified version. And if you feel comfortable moving on to the next one, you can do that instead. So let's slide our heels a little bit closer to our buttocks. Normal curve in the back, bring your hands up, you know the routine. Tummy muscles are on. Now, our first exercise here is to lift the heel off the bed and lower it back down. That's the modified version. If you're able to, keep your tummy muscles on, keep your pelvis stable here, so try not to roll, try not to rotate as you lift the foot off the bed, just off the bed. It's not much of a movement, is it? Now slowly lower it back down. You could see me having the shakes there, couldn't you? And relax. Let's repeat on that same side again. So tummy muscles are on. You've either got your toe tap, heel raise, or you've got the full lift. So I might go into the heel lift first of all, and then lift the foot off, and then back down slowly, and release and let go. Other side to finish off. Here we go. Left side. You move according to how it feels comfortable for you, whether it's a foot raise or a heel raise, and down. And our very last one. Here we go. Heel lift, foot off, slowly back down, and relax. Let's do a couple of pelvic tilts and a bridge to finish off. So very gently flattening out the arch of the lower back. Oh, that feels good, doesn't it? And roll back through. And one more time, flattening out the arch of your back, just lifting your buttocks slightly. And roll back through, arms down by your sides. Press down, lift up. Very safe, very comfortable. And lower down, a really lovely way of taking pressure off your lower back, especially when we've been holding those movements there. Just releasing and down. And to finish off, let's relax our tummy muscles. So arms down by your sides, close the eyes down, let the shoulders go, relax the belly, relax the thighs. And let's breathe slowly and deeply in through the nose, into the belly. Feel the belly rise with the in-breath and allow the air to fall away.
Now we've completed our exercise routine for the moment. You can do this exercise routine once a day, a couple of times a day, every second day, whatever feels right for your recovery and whatever feels comfortable for your body. Now, coming up next, we've got walking guidelines for weeks 1 to 6, so you might like to catch that video now. And let me know in the comments below if you'd like some progression exercises for after week 6, and I'll bring you those in a future video. So thank you so much for watching today. I really hope you benefit from these exercises, and I look forward to seeing you in the next video. Goodbye for now.